Hello, Assalamu alaikum. In this video, we will understand about the myocardial infarction. So, what is the myocardial infarction? It is STEMI or N-STEMI formation. So, this is the type of myocardial infarction. So, what is the STEMI? S-T-E-M-I and no N-STEMI or non-STEMI. So the non-STEMI is the non-ST elevation myocardial infarction. In this way, the electrocardiogram will not show the ST elevation rather than the ST elevation, the S and T wave. So a non-ST elevation myocardial infarction is a type of heart attack that happens when a part of your heart is not getting enough oxygen. When not getting enough oxygen, the tissue of the heart will be die, and in this way the contraction of the heart will not possible. That is why it is really basically is the N-STEMI for short, and the STEMI, the ST elevation, the S and T waves elevation. We will discuss also with the electrocardiogram. This is a person contained heart, and this heart basically four chamber, right and left atrium and right and left ventricle. Anyhow, this is basically a contain a heart. So you can see in this diagram to understand. So basically, the complication in the heart is the can be a coronary. Here is the right atrium. So we will understand about the coronary artery. This is the right ventricle, and this is the aorta. This is the pulmonary artery and a pulmonary vein. Remember, important thing is that the pulmonary artery is a very crucial to function for providing the oxygen and nutrients to the tissue of the heart. But whenever this will be collapsed due to the plaque, can be a STEMI, myocardial infarction, STEMI, or the blood clot. STEMI means the plaque formation due to the arteriosclerosis, or the blood clot non-STEMI. So it can be a non-STEMI due to the blood clot, ultimately due to many reasons like blood clotting. So this basically the coronary artery disease arteriosclerosis is due to the tobacco smoking, high salt sugar, high salt diet and sugars, fat, cholesterol, and the recreational drug, which that will lead to coronary artery disease cause. And in this way, this yellowish color is the fatty streak, the fatty plaque formation will occur. This coronary artery provides the oxygen to the heart for contraction to eject blood. Cardiomyocytes important to get oxygen for contraction. So if the enough oxygen will not provide, you feel angina, you will pain and discomfort as well as heart attack due to the tissue damage of the heart. This lets understand about the sinoatrial node and atrioventricular node, how it is very important to contract. So here is the signal come from the brain, autonomic signal via a parasympathetic or sympathetic signal. So in this way, the intermedial here is the basically sinoatrial node will get the signal to depolarize, and the Batchman's bundle will transmit the signal to the left atrium from the right atrium, and in this way also the intermedial pathway will transmit the signal to the atrioventricular node. This atrioventricular node transmits the signal bundle of his right and left bundle branch will lead to Purkinje fiber, lead to ventricular contraction. This ventricular strong contraction is important for due to the coronary artery for providing the oxygen and the tissue function. This atria contract when, so the P wave will be arise, while the ventricle contract will lead to R wave, the major wave, Q or S, to T wave will be occur After the relaxation, the ventricle, the T wave will occur. This is the sinoatrial node depolarization will lead to P wave. Impulse arrives in the atrioventricular node, and in this way the when P waves will on the peak, the impulse pass bundle of his, and then impulse pass bundle of branches in the Q waves, and after this basically Q waves, the impulse pass Purkinje fiber. This will lead to R wave preparation, and in this way the basically is the temporal association between impulse transmission in conduction system in the ECG waves. So ECG waves in this way. This P wave is depolarization of atrial myocardium, and the QRS complex is the depolarization of ventricular myocardium, and T wave is the repolarization of ventricular myocardium. So remember this: atrial myocardium depolarization through P waves, and the QRS complex is depolarization of ventricular myocardium, and T wave is the repolarization of ventricular myocardium. So the repolarization in this way, the relaxation phase. But this relaxation phase will not occur if, so in this way, this is a normal electrocardiogram which that show the millisecond 0.8 from the 0, and the voltage is 0 to up is 0.5 and 0.5 negative. In this way, here is we are understanding about the STEMI and non-STEMI electrocardiogram showing the heart attack. So in this way, STEMI and non-STEMI. So in this way, here is we are focusing the S to T waves, basically ST waves. So that is why it is known as the STEMI, STME. So the STEMI, it is the normal ECG. This is the STEMI. It means the S and T elevation, while the non-elevation, non-ST elevation is the not elevate the T waves. So that is why in the electrocardiogram we can understand that. The risk factor is age 45 to 60 year, while the sex is men have earlier than the female or women. Family history and inherited or condition present at birth. So that is important things you should need to understand. So remember that things in the electrocardiogram, the STEMI is show the elevation of the T waves. So the ST waves, ST elevation, while the NSTEMI mean non-elevated ST waves. So the ST elevation myocardial infarction. In this way, it will lead to heart attack. So let's understand about there is a condition that our direct cause is a plaque, slow blood flow and clogged artery lead to cause heart attack, while the vasospasm is the lining of smooth muscle for vasoconstriction, relaxation, pause in artery. In this way, the smooth muscle of the artery like coronary artery or other artery will not work. Coronary embolism is blood clot that get stuck in heart arteries to stop blood flow. While on the other hand, this is the basically clotting factors which that activate will lead to thrombosis formation, etc. Injury, trauma to heart will lead to myocarditis sometime because the friction will lead to myocarditis if the lubrication will not present or the many things. So the inflammation of the heart muscle due to infection will lead cause this problem, and the poison and toxins, the carbon monoxide poisoning can cause also the myocardial infarction. On the other hand, the indirect causes is the high blood pressure, tachycardia, the fast heartbeat, aortic stenosis, the aortic valve problem, pulmonary embolism. So aortic stenosis and pulmonary embolism we will discuss in the next video, but in this way you should understand. Just remember. Let's understand about the symptoms. So chest pain, angina, and trouble in breathing, short breathing, and heart palpitations, high-headed dizzy, and fatigue. On the other hand, the radiated pains. So pain will transmit from heart to back and your arms, etc. during the angina, and nausea and vomiting. So remember these things. This is a sign of the heart attack due to the myocardial infarction. It means the myocardium will be die. The tissue of the myocardium will die. Diagnosis is the electrocardiogram, ECG, lab testing, imaging, echocardiography, and computed tomography, CT scan, and the magnetic resonance imaging, MRI. And this management or treat the basically the precutaneous coronary intervention, PCI, medication the like aspirin and antiplatelets, anticoagulants, angiotensin angiotensin converting enzyme inhibitors. On the other hand, the beta blockers, which that also work to slow down the heartbeat, while on the other hand, nitroglycerin, statins, coronary artery bypass are grafting due to the surgery. So the myocardial infarction is the ST wave problem. In this way, the basically the ventricle will not relax even. Thanks for watching. Bye.